Good afternoon, ladies and gentlemen. A warm welcome from Eyezone Education team. Today we have all gathered here for an educational webinar on the topic Insights on Low Vision Practice. Before I introduce you the topic and our esteemed speaker, may I remind the audience of a few housekeeping rules. Please note this presentation is being recorded. To applaud, please use the clapping hands function, which is in the reactions button along the bottom toolbar. In order to see the speaker in full screen, please select speaker view instead of gallery view in the upper right corner of your Zoom screen. Switch your video off and mute the microphone to avoid intervention. This will conserve bandwidth and facilitate a smoother conference experience. Please type your questions into the chat box in your control panel and select the option to send them to the host. Note that questions will be filtered for the Q&A at the end of the webinar. We will do our best to accommodate all your questions. Thank you so much for your cooperation. Now let's move on to the session you all are waiting for. Vision impairment is a major public health concern. In the Middle East, as in many other countries in the world, rehabilitation services are often not a priority for healthcare providers, and as a result, persons with visual impairment are not likely to achieve their full potential. Therefore, Eyezone's goal is to conduct a series of webinars and interviews on low vision topics to build awareness regarding disease. With us today to present the first webinar in that series is an expert who has done exemplary work in the field, Dr. Ithar Rishdawi. Dr. Ithar is an assistant professor in optometry, the head of the optometry department and optometry and low vision clinic at An-Najah National University, Palestine. Dr. Ithar has received numerous awards, published many scientific articles, and regularly presents at international conferences. She was instrumental in establishing the Low Vision Center at An-Najah to be the only center in North Palestine which provides low vision assessment and rehabilitation services. We are lucky to have her with us today. It is my pleasure to now invite Dr. Ithar to present her topic.
Hello, thank you so much for the great introduction. I'm so glad to be with you today. Hopefully, maybe in the future years we'll gather, not virtually, we'll gather together for such webinars. And thank you for inviting me, and we'll start soon. I'll share my slides. Okay, so good afternoon, everyone, and welcome to the Insight on Low Vision Practice webinar. This talk will be the first of a series of webinars that will introduce you to the topic of low vision, discuss the prevalence and nature of visually impairing disease, explain the ocular disease lead to low vision, outline the effects on visual functions, and touch on the social and psychological effects it could have. And it will explain how to assess the requirements of visual impaired patients. And at the end, we'll describe some of the optical and non-optical aids used for people with vision impairment. So this talk will be divided into two parts. In the first part, we'll talk about introduction, some definition, and numbers of low vision, risk factors that could lead to low vision, and causes of visual impairment. Then we'll take a break for 5 minutes. Then we'll talk about the effects of low vision, the assessment, and how to prescribe for people with low vision. So as we all aware of, vision is the most dominant of our senses. It plays a critical role in every phase and stage of our lives. Sometimes we take vision for granted, but without vision, we struggle to learn, to walk, to read, to participate in school, and to work. From the moment of birth, vision is critical to the child development. For infants, visually recognizing and responding to parents, family members, and caregivers facilitates cognitive and social development and the growth of motor skills, coordination, and balance. From early childhood to adolescence, vision enables ready access to educational materials and it's pivotal to educational attainment. Vision supports the development of social skills to foster friendships, strengthen self esteem, and maintain well being. It is also important for participation in sports and in social activities that are essential to physical development, mental and physical health, personal identity, and socialization. Also, in adulthood, vision facilitates participation in workforce, contributing to economic benefits and a sense of identity. It also contributes toward the enjoyment of many other areas of life that are often designed around the ability to see, such as sports or cultural activities. Even later in life, vision helps with maintaining social contact and independence and facilitates the management of other health conditions. Vision also helps to sustain mental health and level of well being, both of which are higher among those with good vision. So, visual impairment occurs when an eye condition affects the visual system and one or more of its functions is affected as well. Vision impairment has serious consequences for the individual across the life course. Many of these consequences can, however, be mitigated by timely access to quality eye care and rehabilitation. The WHO defines low vision as visual acuity less than 6 over 18 to light perception or a visual field less than 10 degrees in the better eye with best possible correction. Visual impairment comprises categories 1 to 5 depending on the visual acuity. So if the person has a visual acuity between 6 over 12 to 6 over 18, he or she has a mild vision impairment, and they would have a moderate vision impairment if the visual acuity is between 6 over 18 to 660, and severe vision impairment if the visual acuity is between 6 over 60 to 360, of course for distance vision. But for near vision, if the patient has an acuity of N6 or M size of zero point 0.8 at 40 centimeters, and the patient is considered to blind if they have a visual acuity worse than 3 over 60. However, the problem with this definition is that there may be people with a visual impairment whose ability to perform everyday tasks is greatly reduced, but who do not fall within this definition. For example, if someone who wants to drive but their visual or distance visual acuity is worse or about 6 over 12, then the low vision services consensus group defined low vision according to the person's functional ability rather than any specific level of acuity or other clinical measurements of function. And it defines low vision as a person with low vision is one who has an impairment of visual function for whom full remediation is not possible by conventional spectacles, contact lenses, or medical intervention, and which causes restrictions in that person's everyday life. So, in this definition, it is not just a function of a disease, but the activities the person wants to do and how they participate in a given life situation. So, this table here shows some examples of ocular conditions and their adverse effects on the patient's activities and participations. For example, if a patient has macular degeneration, they would lose the central visual field. This will lead to a difficulty in recognizing friends and the faces of their friends. So, and consequently, it might lead to breakdown of social relationships. Another example, if a patient has cataract, they will have increased glare sensitivity, which will affect the driving, especially at night. So the person with the cataract may not be able to go out and drive to visit their relatives. So let's talk about the number of people with low vision. Globally, there is at least 2.2 billion people have a vision impairment or blindness, of whom at least 1 billion people with moderate or severe distance vision impairment that could have been prevented or has yet to be addressed, including around 123 millions of people with uncorrected refractive error, 65 millions of people having cataract, 6.9 million of people having glaucoma, 4.2 million of people having corneal obesities, 3 millions of diabetic retinopathy, and 2 millions of people having trachoma, as well as near vision impairment caused by unaddressed presbyopia, around 826 millions. And if we look at the number of people with low vision by region, we see that considerable variation is observed in the distribution of presenting distance visual impairment between regions and income levels. So if we look at the Middle East region here, the one with the circle, with the red circle, we see that there is around 29 millions of people with vision impairment that could have been prevented. 10 millions of them, they have vision impairment that could have been prevented or addressed. And generally speaking, the prevalence in many low and middle income countries is estimated to be four times higher than people with or regions with high income countries. And if we look here at the global estimation of presbyopic patients, for sure, the prevalence of any near vision impairment is highest in regions with longer life expectancies, while the greatest burden of near vision impairment yet to be addressed, which occurs in low or middle income countries. In the Middle East region, the rates of unaddressed near vision impairment are estimated to be higher than high income countries or region, but much less than the other regions such as Latin America, South Asia, and East Asia. There is a number of factors that could affect the visual impairment, which leads to differences from one region to another, depending on several factors such as the age and gender. So distribution of eye conditions varies across ages due to the typical age of onset. While some eye conditions such as myopia, retinopathy of prematurity, and amblyopia occur in childhood, the risk of others, including cataract, presbyopia, glaucoma, and age-related macular degeneration, increases with age. And according to gender, at a global level, there is no strong association exists between gender and many eye conditions, including glaucoma, age-related macular degeneration, and diabetic retinopathy. However, rates of cataract, uncorrected refractive error, and uveitis are higher among women, particularly in low and middle income countries, while higher rates of congenital anomalies, retinal detachments, trauma, and optic atrophy are found among men. Other factors that can influence visual impairment prevalence is the access to eye care, of having the best correction or treatment or operations, and the area of residency as it's an important determinant of many eye conditions. For example, cataract is a leading cause of visual impairment in developing countries, but age-related macular degeneration is a leading cause in developed countries. So let's talk more about causes of low vision. So, what are the causes of low vision? Actually, it is essential to identify the pathology which is causing low vision, not least because of the need to consider whether medical treatment is required. So, you need to understand what the disease is, be familiar with signs and symptoms, understand how the disease affects function, and develop disease specific visual rehabilitation management plan. So, globally, the principal causes of visual impairment are uncorrected refractive error around 42%, and cataract around 33% of people, and other causes such as glaucoma 2%, age-related macular degeneration, diabetic retinopathy, trachoma, and corneal obesities all about 1%. A large proportion of causes are undetermined around 18%. So if we look at the distribution of eye conditions, it varies across ages due to the typical age of onset. The prevalence of visual impairment and blindness are determined by the WHO for three age groups. The first one is the babies and infants who ages from 0 to 14 years. The second group is the middle-aged people who age from 15 to 49 years. And the third group is the elderly who ages from 50 years and older. So the first group are the infants and babies. So there are a few signs that we see in visual impairment infants or children, such as the absence of fixation at birth, absence of visually stimulating reaching around 4 to 6 months, abnormal ocular movements, abnormal pupillary reactions, eye rubbing, lack of facial mobility or expressions, and absence of optokinetic nystagmus, which is important as a sign of integrity of visual system. So there are numerous of ocular disease that cause visual impairment among infants and babies, such as albinism, congenital cataract, congenital glaucoma, Leber's congenital amaurosis, optic atrophy or hypoplasia, or macular coloboma. Additionally, there are a few other reasons or ocular disease such as retinopathy of prematurity, retinoblastoma, primary hyperplastic vitreous, high refractive error, delayed visual development, and congenital idiopathic nystagmus. Among older children, other causes could lead to visual impairment, such as Best disease, cone dystrophy, optic atrophy, retinitis pigmentosa, Stargardt's disease, and X-linked retinoschisis. In the middle age people, the causes are different, such as diabetic retinopathy, pathological myopia, acute optic neuritis, posterior uveitis, and cytomegalovirus retinitis. Most of the ocular disease that leads to visual impairment are diseases which happens in the retina or the posterior part of the eye. The psychological issues are very important for newly diagnosed middle-aged people. So you need to be honest and give them practical advices because visual impairment in this category may result in loss or a change of employment, driving privileges, and a change in interpersonal relationship. So you need also to give them advices regarding genetic counseling about transmission the disease to their children. Let's talk about the visual impairment causes in the elderly. So globally, the leading causes of moderate or severe vision impairment in those aged 50 years or older were uncorrected refractive error or cataract, and followed by, as we can see here, age-related macular degeneration. But in the Middle East, also, we can see that similar causes or similar disease can lead to visual impairment, such as the uncorrected refractive error and cataract. The other common causes that could lead to visual impairment in the elderly are age-related macular degeneration, cataract, glaucoma, temporal arteritis, central retinal artery occlusion, and anterior ischemic neuropathy.